I am Dr. Tobias Otieno, I am a consultant orthopedic surgeon practicing in Kisumu and affiliate consultant at Aga Khan Hospital, Kisumu. Today, I would like to talk briefly about osteoarthritis. Osteoarthritis is a word derived from two different words, osteo referring to bone and arthritis referring to joints. Basically, this is a condition that affects joints, and in medical terms, the joints that are affected are referred to as synovial joints. So these are joints that are lined with cartilage on either side and also lubricated by a joint fluid. This then ensures that movement between the two adjacent bones is smooth and frictionless. So osteoarthritis occurs when this normal function of joints is affected by wear and tear. Osteoarthritis can be classified either as primary. Primary means we cannot identify a specific cause. Broader subclassification is called the secondary osteoarthritis, which is osteoarthritis that follows joint damage either by disease or by injury. The notable feature from all these causes is that the joint cartilage is worn out. It becomes rough, and so the example that I have is of this model of the knee joint, where this is the part of the thigh bone and this is the leg bone. So you notice that the area, the lower part of the thigh bone, is surrounded by the blue colored area. That is the area representing the cartilage covering the joint. And then if you look keenly on the lower bone, which is the tibia, there is cartilage on either side of the tibia. And so because of the smooth nature of the cartilage, joint movement is smooth, aided by a lubricant which is in the joint. Now, in osteoarthritis, that joint cartilage is worn out. And so whereas we have a smooth joint here, now we end up with a joint that is rough. The area that is highlighted as red is the area where the cartilage is worn out from. So that area is denuded of cartilage. And so during movement, that then causes excessive friction, and the friction causes pain because the tissues there have nerves on them that will be irritated by that rough movement. But over and above that, you also notice the roughness that is on the edges of this, what we consider arthritic joint. So a combination of the roughness and some of the other irritations of the joints will cause pain. Osteoarthritis is diagnosed by what we call a clinical assessment. So we will gather information from the client, which joint is afflicted, how bad is the discomfort or pain or limitation of joint movement. We will then gather from the history whether there was any previous disease or injury in the joint which then exposed the joint to wear and tear. We would also like to know what the lifestyle of the client is. What do they do for a living, or what did they do earlier on? Because we know that people who are involved in intense sports activities are likely to wear out their joints earlier. They are more likely to sustain injury in the joint. So having gathered that history, we will then examine the joints, and there are features that we look for. We look for alignment of the joints, where the joint alignment can be estimated. So, and at the knee, I'm referring mostly to the knee because the knee is obviously visible to the eye, and if there is an angular deformity of the knee, we can be able to identify that as a feature of this condition. Number two, we also want to feel for any crackling sounds within the joints. And of course, we want to observe the limitation of joint movement, how well the joint is moving. Does it bend fully? Does it straighten out fully? And then, of course, is it aligned in terms of the lower part of the limb and the upper part of the limb? Now, once we have done the examination, we will then go to investigate, and there are investigative tools which we use. An X-ray, basic X-ray, is usually sufficient to make this diagnosis, and therefore we almost never require other investigations such as MRI to be able to make this diagnosis. So once we have made it, and the things that we look for, we want to look at the alignment of the bones on the X-ray. We want to look at the space within the knee joints, within the joints, whether it's the knee joint or the hip joint or the ankle joint. We want to look at the space between the bones of the joints. And there are other features that we also look out for. The commonest is protrusions on the edges of the joints, okay? That which I'm highlighting here, these protrusions, we refer to them as osteophytes. So a joint which is arthritic and which has osteoarthritis will demonstrate a bit of bone protrusion on the edges of the joint. Once we make that diagnosis, how do we treat it?